And scene. KFUG Community Radio. It's 4 minutes into the 11 o'clock hour. Paul Kurtz with you. Community service, the show. Amanda Doctor at that microphone. And at this microphone, we've got Jermaine Brubaker from RX Safe Del Norte. Now, is that, am I shorthanding that? What's the full name of the whole coalition? It's like that coalition or something.
Yeah, I mean, you can add opioid coalition onto it if you want to. I just do that for so people actually know what it means, because most people don't know that even RX stands for prescription. Right. So it's a little bit confusing, but yeah.
So tell me about the illicit drug summit you went to.
Yeah, so
were the illicit. What kind of illicit drugs do they have?
No.
It was a big exhibition hall.
It's the RX and illicit drug summit.
Yeah, so it's something that's been going on for 14 years. It's a big national convention. I got recommended to it from other coalitions because they're like, you can learn anything, and there was a million tracks. I even got the extended ticket so I could watch things for 90 days because there was no way I was going to hit everything.
Oh, gotcha. So afterwards, you mean online?
Yeah, I can still go back and I can watch the recordings and get access to slides.
Wow.
Yeah, because there's a ton of information there. But
what's new in drugs?
What's new in drugs? There is pink cocaine, and then there's some other new stuff. I didn't go to much of the new drug workshops because I'm more about tools on the ground, and we don't see new drugs here for a decade. So
another slight for Del Norte.
Everybody else is starting to get rid of xylazine, and we're starting to get it. So
there's. Okay, I'm sorry. There's
red curtain.
We laugh because we love. It's just it's. So where was this?
So I went to Nashville, and I got to stay at the Grand Ole Opry place, which
is
jelly. Yeah, and it's way too expensive.
What do they have a whole experience there, a whole amusement park kind of deal thing going on?
I went to the water park and on site. But
the Grandpa Jones
there's 4 atriums there with a full waterway that you can go through.
If you need another representative next year, I volunteer as tribute.
It will be there next year. I don't know if I will have the funding to take people next year.
Yeah.
That's a theme.
So that's a theme that has come up in this. And it was a lot. This thing started 14 years ago by Hal Rogers, who is actually the head of the Appropriations Committee and a Kentucky representative. In his county was the hardest hit in the nation.
Now, do I perceive this weird? It seems like Kentucky Republicans, when it comes to opioid problems, aren't like other Republicans. They have they've got skin in the game.
Yeah, they have a lot of skin in the game. Yeah. That whole Appalachia with the pill mills and all that they were hit really hard in the 90s, and they're still seeing the aspects of it. And they've really led the country too in some innovative stuff as well. But as they were talking, budget cuts were coming. So they were talking about how good things are doing, how much work is happening in recovery, how much important harm reduction is, and then we're getting these budget cuts coming down from Trump.
But have to come through the Appropriations Committee.
It has to go through the Appropriations Committee, which is Hal Rogers is the chairman of that.
Yeah.
But they are really talking more about borders and DEA taking away harm reduction. Harm reduction is actually in Trump's, we don't want harm reduction funded by the federal government anymore. So that's naloxone distribution. That's fentanyl test strips. It's not just
proven things that have saved.
And things that they were talking about how important it is to have. One, for every 6 naloxone you dispense, you save 1 life.
Right.
So, and a lot of this money trickles down as well. So they're taking a lot of money out of SAMHSA. So that's the Substance Abuse and Mental Health Services. So that's getting folded under something else, and $1 to $2 billion are being cut out of that. And then most of that money trickles down to things like SOAR grants, to the state opioid response grants, which we get a ton of funding for that around COSUP, which is opioid and stimulant. So there's a bunch of money being cut there. We already lost one grant that we had been awarded a year ago, and they pulled it back under that Reaching Rural that I'd been working on too.
And so the Reaching Rural thing, I've had Valerie Starkey on here talking about that as well. That's gone now, right?
Well, yeah, the whole program is gone.
That's what you were saying.
Yeah,
before.
So we're continuing the work here through we've translated it to the opioid settlement work group and the coalition work, but the funding that we got for that and that continued support that we got from the Bureau of Justice is gone. That department's completely gone. honestly, I didn't even get my last invoice paid, so I'm out money.
Wow.
And that's not through our county contract. That was because I was actually working as a staff with them too.
And no attempt from folks like Hal Rogers, was that his name?
Hal Rogers, yeah.
To indicate how they're thinking their way through this?
Not yet. So they were very in support of all the work that we're doing, but they also, almost everything they talked about was borders.
Right. And they've been responsible for cutting the funding to that very work that they're lauding, right?
They're actually taking money out of things like SAMHSA and putting it to borders.
Yeah,
So yeah, I printed out the whole what's it called? The
indictment?
Yeah. Well, it's basically for fiscal year 2026, what's coming down from the federal government.
And the directive
then that goes to the appropriations committee.
Right.
And then the bills and all that stuff get written and passed to how things are going to get spent, and the budget gets made. But there's a lot of money being cut.
Yeah.
Yeah. And in the direct work, we're going to start to see those impacts pretty quickly here. There's a lot of work under these grants.
How so? Can you outline some of that? How with that?
Some of them. Well, I'm not sure what will get pulled all the way back and what will just not be available again too. They haven't made those decisions yet, but to be expected, like a lot of our treatment work falls under SOAR grants. So that is like the building or the creating of, or the sustainability of opioid treatment and other drug treatment. Harm reduction, we're going to see a big reduce in that, because if the SOAR grant is going away, that thing funds a lot of harm reduction outreach in California and in our region. So we're going to see less naloxone, we're going to see less fentanyl testers, we're going to see less treatment options, and we're going to see less people being able to help people.
Right.
Because this is where like the innovation comes from, is like you need people to hold people's hands to get them there. And
yeah, exactly. And for however long that takes, that's part of this whole thing as well.
And one of the ways you get them in is harm reduction outreach, because you're building that rapport, you're getting those people to trust you and not judging them of like, you have to be abstinent before I'll help you.
Right.
If it was that easy, they would have done it, right? Like nobody wants to struggle that hard, and it can take a while. There's a lot of hoops we have to jump through. We were just doing, in the opioid litigation group, we're just doing all these interviews of people with lived experience and family members and frontline, and it's like sometimes people had 14 attempts before they were able to like have any kind of sobriety, just because of how many hoops it has to jump through. Maybe they show up and then they don't have the right insurance, or they don't have the right ID. And it's not just one step of like, oh, I got to go get my ID, right? Like if you're not living in a stable place or you don't have stable income, like just getting to the DMV, getting that appointment, paying those fees, finding your birth certificate.
It almost becomes insurmountable, especially when you're already struggling.
Yeah, so it's things like that the people who do the help with, they're helping people get all these things in line, helping contact the county they were born in so they can get their birth certificate. It's not easy stuff, and that's just like the first step. That's not like finding out where your kids go, finding out where your pets go, finding out if you're gonna have a job when you get back, if you were working, and then coming back to the community and having to rebuild a new life in a place that's not easy to rebuild in the first place, with a lot of stigma, because you've already probably burned some bridges and you've created a reputation that people may not trust you as much either. So there's a whole lot of work on that end. But yeah.
Wow.
I mean, we could talk forever on the whole opioid journey.
So I mean, back to the conference.
Yeah, the conference.
What sorts of other things besides the I mean, unless there's more you want to cover in the funding
we could,
parts.
but I mean, we could talk for an hour on just the budget.
Exactly.
Like I printed it out and have been going through it and just like lining stuff that we're going to probably see impacts of, not just in our area, in education, all sorts of stuff, but we'll have a whole conversation about that later. But some of the really cool stuff that came out of it were some really inspirational ideas, and some of those are around naloxone, of course, because it's one of the biggest life-saving drugs out there. So naloxone leave-behind programs, there's a lot of talk around that, about like we can leave naloxone at these high-risk calls. When people have an overdose, you can leave naloxone behind, especially if they refuse to go to the hospital. Make sure they have it. If we're doing high-risk home visits or crisis calls, leaving naloxone behind in those situations is shown to save a lot of lives.
So who would leave them behind? Like first responders?
First responders, responders, whoever's on the behavioral health crisis team, even like child protective services programs have been doing stuff like this.
Any government comes through the door could leave these
anybody that goes through the door and works with those people, you can give them the resources and just include the naloxone in it. It's not a big deal, and it's something that like those high risk situations, they don't necessarily know where to get that naloxone in the community. So like having it right there, just put it in your medicine cabinet. Like it's there if you need it. And if you don't need it, great. But if you do need it and you don't have it, that could be life or death.
Yeah. Wow.
Yeah.
Okay.
So naloxone leave behind programs is really something that we've actually been talking about regionally a little bit. I've been working with Pinnacle Treatment Centers a little bit. Like we're both like, we want to get this started. We're like, sweet, let's work on it. The other thing was that EMTs can do Suboxone. So Suboxone is a medicated assisted treatment for opioids. So once somebody is Narcaned, it puts them in a hard enough withdrawal that you could start them immediately on an MAT drug like Suboxone. And that lasts 24 to 48 hours and helps from keeping them overdose again. So even if they don't go and start treatment right away, they still have that extra level of protection for the next 24 to 48 hours, which is a big deal because we see a lot of people overdosing again, and that one is a lot harder to reverse with the Narcan.
Oh wow, really?
Yeah, because you've built up so much opioid in your system at that point that it can be harder to reverse the second overdose.
Wow.
Yeah, so it gives that level of protection. I mean, honestly, if we could give people the Sublocade shot, which is 30 days worth of protection, but that might be a little invasive. But there is that option out there too. But yeah, being able to do those quick starts with EMTs, I know that's a big ask for EMTs, but
how so? What's different about that for the EMT?
It would be like having to. There's waivers, and it's a little more complicated in the world of Suboxone. A lot of those barriers have been removed, but the oversight that is often needed for Suboxone, they might have to have a medical director sign off on it.
Okay.
It's an extra step that they're just not trained in and don't know about.
Right.
And a lot of people are refusing ambulance rides as it is, so like they might refuse other services too, and it's just kind of like and just the cost of having it on board. But those are all things that would pay itself off in the long run.
Exactly. That's what a lot of this is when we talk about the funding being cut, but it's all, people don't realize it. And for decades, this has been shown to be a net positive, economically for the society at large. Is that the more lives you save, the more you enable people to live and to live healthily, then the healthily they live.
Yeah, we've seen a 25% reduction nationwide in overdoses. In general, 33% in fentanyl.
How can you justify cutting this stuff?
As the tide is turning, the money is going away. It's like we haven't accomplished anything. That's still 150 people dying a day. Wow. Even with that reduction, that's still 150 people. That's a plane full of people pretty much daily dying. And we've just started to turn the tides because it's been funded really well to do this big multi-level approach to this. Like it's not just borders, just DEA, just law enforcement. Those are important parts. We need to stop the drugs from coming into our country. We need to stop the drugs from getting on our streets. But all the root causes, all the people who are already addicted, all that stuff doesn't just go away.
Right.
Yeah.
Right, and given the fact that we haven't been able to stop that ever, and that harm reduction actually saves lives, and it's proven to save lives. I mean, that's a no-brainer, and so the people with no brains are making the decisions, I guess. So, anything else come out of the conference that you want to share? Any other?
Just really good connections, and if I'm going to be sharing a lot more information out with our teams and with the Opioid Coalition coming up with all the cool stuff that I learned, because I'm going to leverage this learning opportunity as much as possible to build our region and our responses. But there was some stuff about like new drugs that are coming out, like you asked, but like I said, we're not going to see those.
We're not going to see those in a while. It'll take a decade.
But I also, coming out of this, do you want to talk about T.A.C.O?
I have one last question as you talk about, because T.A.C.O is a subset of this larger question that I have for you. If you're talking about building sort of a regional sort of way to respond to these changes, right? Is the funding there for that? Being in California, is the funding there for this sort of thing? Or
so
is
like
it
I said, those state block grants come from the federal. So a lot of the money that California is spending on this has been federal funded. There
but do you
is still
see
state funds. There's still opioid abatement funds, but those really aren't that much to like fill this gap.
Is it too early? Have you seen any sort of indication from Sacramento that there's going to be like a reshuffling of things to try to fill some of those holes?
We haven't heard a lot. We've heard a lot of silence, honestly, because it's a lot of like, well, we're kind of waiting to see.
True.
We know that California is in a deficit this year too, so a lot of things were already kind of on the chopping block and reductions, and a lot of like health access stuff in general, not just opioid stuff. Is kind of on that chopping block. A lot of education stuff is on that chopping block. So, you know, it's kind of a wait and see, but we do know that we're going into some really lean times right now. Yeah. So it's going to be being really inventive, I will say, with what funding is out there, and trying to get more philanthropy involved would be important. But, you know, this isn't the hot, sexy topic that people want to invest in, and people want to invest in youth, but they don't want to invest in addiction, right? Like, it's much cooler on one side than it is the other. So, you know, just kind of switching that narrative and trying to talk to philanthropy, and also just leveraging what we have, working closely together with all the different folks that are doing this, so that we're not being redundant. We're not really anyway being redundant, but it's like, it's kind of like, how do we get to the bare bones and like work that dollar to the last,
economies of scale and share it at the exactly,
all that stuff. And there is some changes coming to Medi-Cal for drug coverage and stuff like that, but then also Medi-Cal is looking at, it might have a reduction in funding as well. So like, there's opportunities, but at the same time, we're like, it's kind of a hopscotch right now, like trying to navigate, where's our funding going to go. Luckily, this coalition is funded through Klamath Promise Neighborhoods through September 2026. So I at least have work I can do locally until next September.
Gets us back to C.A.T. Let's discuss C.A.T.
Yeah.
Anagram. We'll start there.
Yes.
That's awesome. That's really, really cool. And it's the result of when a taco and a cat love each other very much. Thank you, Monique, for that wonderful joke.
What did we say that Taco Cat stood for?
Oh yeah, I've memorized it.
Okay, good. All right. Amanda's in the clutch.
Teen Awareness, Combating Overdose, Community Advocacy Training.
Woo!
C.A.T.
C.A.T. Yeah, we pretty much explained it all in the title right there. No, but so what we're doing over this summer is we're partnering C.A.T. Norte, KFUG, and the Workforce Center are partnering together to bring on 5 students. So they'd be incoming sophomore, junior, or seniors in the local school districts, and be hired through the Workforce Center, work with us at KFUG and C.A.T. Norte to learn about harm reduction, to learn about naloxone, to learn about fentanyl test strips, and then to help us create a campaign that will be launched for International Overdose Awareness Day on August 31st, and to join me at the health fair on July 26th and demonstrate some of the stuff that they learned.
Wow, that sounds like a lot of work.
It is. You signed up for it, sir.
You're welcome.
Yeah. It's this is exciting. It's actually what sorts of like we've talked about the media campaign, but what sorts of things would the kids be producing?
Yeah, so we're hoping, I want to leave it a little bit up to them, because it could be anything from a podcast to a poster campaign to a social media campaign. Really what they think is going to appeal to their peers the most.
Okay.
We're going to be teaching about different mediums as well, and doing like pros and cons of this. And so they might be experimenting a little bit, because it's also a training in media.
Yeah.
Right. So that's interesting. Okay.
I'm leaving it kind of open-ended. I will help guide them through the process to make sure everything is like correct,
parameters.
So we're not giving out bad
parameters.
information. And then we have some money to do some promotion either on social media, or if they want to do radio ads or whatever, like I think is gonna, like, they could produce videos if they wanted to. It really just depends on what the group's most interested in, and the way that we can get information out about how to prevent opioid overdoses, especially to their peers who may be experimenting with things for the first time. And fentanyl is in 7 out of 10 fake pills out there. So that, and a deadly amount of fentanyl, not just like a little bit of fentanyl, a deadly amount. And,
oh my God.
And you can order them through Snapchat. You know,
hey, quick question. Yeah. How do you tell it's a fake pill?
You can't without testing it.
Womp, womp, womp.
Yeah. So, and you have to test all of it too. You can't just test a little bit of it because it likes to clump together in whatever you get. So it's a process.
Yeah.
So just knowing and understanding the landscape, because it's very different than it was when I was growing up, when a lot of these people's parents were growing up, and even like 5-10 years ago, like their older siblings were in a different world. So fentanyl is just so everywhere. We haven't had youth deaths in a while. 2 years ago, we had a couple under 5 deaths.
Oh, wow.
Yeah, and we were the only ones that had those during that year in 2022. But that hopefully was a fluke, and to a bad, terrible fluke.
Right.
But we haven't seen that again. But we want to keep those youth numbers off the board.
Right.
And this is how this is our big prevention kind of push, is like, this is how you be safe, because we know that kids are always going to experiment. We can do all the prevention we want, but experimentation happens, and we want to make sure that first experimentation doesn't kill them, or the second, or whatever.
Right.
Yeah.
So when does C.A.T begin?
C.A.T begins in June. Do you remember the start date? I'm looking she had the other memorized, but the May 22nd is the deadline to apply. So if you have a young person who's interested in healthcare, acting, social media content creation, any of those things, send them to the Workforce Center or to their counselor's office to pick up an application. And they'll get hired through the Workforce Center. They go through a boot camp. And then we interview all the kids that go through that boot camp. And then we choose each other. The 5 that choose us and the 5 we choose will work together and make some magic happen.
No, that's really exciting. That's really cool. And yeah, we're going to be doing, we talked about designing this thing along the lines of like the YTA classes from a few years ago.
Yeah, we both have a lot of background with YTA and all those things. So it's really like teaching these kids some skills and doing community service at the same time.
And they get a stipend too, right?
Yeah.
How much money they get?
They get, I don't know, they get minimum wage. So it's not technically a stipend. They get
so it's based on, okay. And that's through the Workforce Center?
It's about 180 hours.
Gotcha.
So they get about $2,000.
Dang.
Yeah.
Wow, I may sign up. Wait a minute. Wow, that's fantastic. Okay, all right. So I mean, and we're talking about.
And this we applied through KPN funding too. Klamath Promise Neighborhoods. Want to do a shout out to them as well for giving us the cash to make it happen.
and it's like the end of the KPN grant is approaching, and it seems like it's really what's happened in Washington has really highlighted just how important those funds have been for the local
please
community.
reapply.
To who?
Promise Neighborhoods.
Yeah, to who?
Who should reapply?
Because they got, who are you talking about applying, and to whom?
Oh, Your Archive should reapply
to
the Promise Neighborhoods.
Which got the money from?
I'm not sure where
the Department of Education.
Oh, is it Department of Ed?
Yeah.
I did not know that.
Yeah.
All right, well, never mind. There's probably no money.
We got to do this before the money runs out. Help us.
We've got to, we have to teach all the kids media and solve all the drug problems in the region.
No pressure.
With the year and a half left.
Yeah, we are, because we are totally capable of doing that.
Of course.
I found those dates.
Oh yeah, when does it start? I forgot we were even waiting on. Yeah.
So yeah, the deadline to apply May 22nd. It's June 16th through 20th is the boot camp at the Workforce Center, right?
And what's that entail for a youth? I forget. That's going and learning about having a job.
Yeah,
right?
It's basically learning about having to have a job. They give you some interview tips as well, because we're going to be interviewing them, how to dress appropriately, how to call out sick if you need to call out sick, some basic job skill training.
Do they do remedial?
Yeah, actually, the Workforce Center does. Yes.
Wow. Okay.
Yeah. So they're the experts in these areas, and they do a lot of job training like this. Maybe you want to send your staff to that.
I wasn't going to say that in so many words.
That's all right. I'll say it for you.
Thank you.
So it's about a week-long boot camp, and then they do. They're we call them speed dating interviews.
Right.
So they get to interview with every placement site. It kind of rotates around so that they have a chance to really.
That's one way to practice. Yeah.
Yeah. From both sides. I've sat on the other side of the table too, and you're just I have new skills now. I'm just interviewing people.
Really, it just seems like you get attached to the like the 5-minute interview. So when it went long in real life, you're all like, hey, I think we've hit all the points.
Right. Wrap it up.
I mean, yeah, it's going long.
You're all
stretch. Don't
5
stretch.
minutes. That's all we need to know if you're fit.
I got a tight 5 for interviews.
Yeah, and so then after they're placed, they'll start out here at K.F.U.G. And if you don't live locally, there's some money built into the budget for transportation too. So if you live in Gasky, if you live in Klamath, please still apply. We have options for you to get here and to probably to give your parents some gas money.
Which would be really, really helpful. Sure.
Yeah.
And then we'll be learning about everything that RX Safe Del Norte does, and then how to put that into media of all sorts.
Yeah. So it should be pretty fun, and it'll be really cool to see whatever campaign they create launch for that International Overdose Awareness Day.
And how long does it last? When are we done with this? We have to be done by the end of the month?
So June 23rd is the start date of our program, assuming we've hired all of our youths from the workforce program. Gotcha. And then we're going to be working through June and July, right?
Yeah.
Yes, June and July.
To the beginning of
because the whole campaign.
Oh yeah, they're done on August 1st. So the campaign will
Yeah.
roll out after they're done.
That's awesome. That's really cool. Wow.
Okay. So that gives me time to get it placed places or printed or all those things that need to happen.
And we're going to put a window in that wall.
Ooh, exciting.
It's going to be like a part-time gig. Like you come here for a few hours a day. You learn from the team. We have stuff to work on. And just learning a lot of really useful skills, both for community building and
community outreach.
There'll be other groups working in here periodically through that time too. Other groups doing different media work. We've got 2 other programs that we're building with 2 other partners, and a podcast and some other things going. So
K.F.U.G. has become the youth center.
It's gonna. That's why we need the window in that wall.
Just a window. That's all.
Just the window. Then we're good.
No, make it one-way glass.
Huh?
Make it one-way glass.
One way
extra.
But
I thought you said we'll make glass, and I'm not getting that into it. I'm not going to try to make glass. Hey Ralph, how do you make glass?
We're going to go down to the beach, and we're going to
we're just get it really hot.
Really hot. We're going to get.
You just call down the lightning.
No, that's it. That's what we'll do. We'll put the tower up.
Good looking out.
There it is. Okay, cool.
Oh, I thought we were going to call some old Norse gods or something.
No.
Well, both can be true.
Yeah, they kind of work out that way. So is there anything else we need to know about C.A.T, about RX Safe Del Norte moving forward, about what your summer's going to be like?
My summer's going to be busy with you guys. I'm excited. I haven't got to work directly with youth for like a year now, so it's like I'm like, get that energy back. But overall, we're working on a bunch of different projects. You can check out our Facebook page. I always post stuff on there constantly. I've been posting stuff about budget stuff and call to action and like who to write for some of these things. But basically, Hal Rogers is the chairman of the Appropriations Committee. I'm getting to be his best friend because I'm writing him on a constant basis. But also Huffman is a really good person to talk to, and our local state senators. They're the ones that technically represent our interests, but they really pay attention to a phone call. They really pay attention to a letter that you wrote yourself, not just the government form things. They tally those, but when somebody takes that extra time to make the phone call or write the letter, just say protect SAMHSA funding. It's so important. Mental health services, things like Coastal Connections are related to SAMHSA funding. Things like behavioral health are related to SAMHSA funding. There's so much out there in that category that helps people that we can't have go away, especially in our community. We don't have a lot to fall back on. We're already pretty tight. So, we can't. We're going to be real lean. We're going to be tighten that belt to the last notch.
And this is a high need area. I was looking over the data points from
this
the coalition
has been scary.
call.
Yeah.
And the Del Norte is number 1 in the state for emergency room overdose visits.
Yeah. So
number 1 in the state.
Number 1 in the state per capita.
Yeah.
You have to add that little thing.
Well,
but we're still number 1.
We're number 1.
And we were number 2 last year at opioid overdoses. We've moved down to number 7 this year. Wow. But and we're seeing a slight reduction, but we're not seeing it like we are in other communities. Like Humboldt is seeing like a 30% reduction.
Wow.
But they've had a lot of concentrated funding. They have a lot more treatment options. They have a lot more harm reduction and outreach options. So a lot of our people go to Humboldt to get those services.
Right, yeah.
So we're trying to bring as much as we can back up here, because imagine trying to get your life together and you have to travel to get services.
It's another burden.
Help. Yeah. So one of the things we're trying to do is bring that methadone clinic up here, because that will, people are driving 4 hours a day.
Wow.
On a bus that's problematic. Sometimes it picks you up, sometimes it doesn't. But every day to get your medication, you're not able to rebuild if you have to do that constantly. When they do it for 3-4 months straight, then they can start to get take-home kits, but it takes that long to get it. And when we have unreliable transportation, we have unreliable roads, we have all those things. So we've been in negotiation with bringing them up here. And we had originally looked at a mobile outreach unit, but they couldn't do that because they didn't have a brick and mortar close enough. So it'll be an actual drop-in site. So we're working with them on, wraparound services for that, getting, we're going to probably need a patient navigator. So if you are interested in this stuff too, Stalent's looking for a patient navigator. There's a lot of positions out there that if you have lived experience or you really care about people and their health, and there's a lot of work out there.
Wow. Okay.
Yeah. Even though we're losing funding, there's still work out
That's
there.
yes. I was wondering too if there's any chance of RxSafe Del Norte partnering in any regard with like the new empath unit that Sutter wants to put in out at the hospital, the mental health.
Yeah, that would be awesome. And the way I would partner with them is making sure that they are up to date on those quick starts and stuff like that. So if they're going out, one of the things that people are supposed to be able to do in California is walk into any emergency room and get a quick start on medication. It's not really happening here. There is funding up here. It's happening occasionally, but for the most part, from the feedback we're getting and from what we're hearing, is that it's just not an offer that's often given.
Right. Yeah.
So people, and people won't ask for it because they don't know that they could get it. Also,
what's a quick start? I'm sorry.
So a quick start on like a medicated assisted
like
treatment,
Suboxone.
like Suboxone.
Okay, gotcha.
Yeah, so you could get a quick start in the ER.
Okay.
And then they can't maintain that prescription for you. You would have to go to like Stellit or Open Door, UIHS or Aegis or someplace else like that to get that. Because Aegis does Suboxone as well as methadone too. So,
who runs the Suboxone program? Do you know? At Open Door?
At Open Door? Yeah. So, well...
Is it a third party?
No.
Oh, okay.
It's
It's
in-house.
Open Door?
Yeah.
Okay.
And they are, they have new behavioral health telehealth through there, which is really cool. So it's really expanding options. We know that, telehealth isn't always the best ideal. Like some people really like that face-to-face, but it's just, we can't hire enough people. So it's being able to expand that. But even if you're not a patient in Open Door, you can still go in, and if the MAP program is open, you can still get started there. Same as Stellit Health, and same with Aegis. You can just walk in and say, I'm ready. And there may be some hoops you have to jump through as we've established. But hopefully they'll be able to get you there.
Wow. Okay. That's a lot, and a lot going on, and a lot happening. We've got, if you have a youth that you feel might be interested, or you are a youth yourself who is interested in the betterment of the community, in harm reduction, in trying to...
Making money?
In what?
Making money.
And making money, capitalism. But, it's non-profity capitalism, so,
you never make enough money.
You never, that's it. It's it. That's exactly what it is.
You feel good about your work.
Yeah. For like a good maybe 4 or 5 months. Yeah.
Yeah, we can even talk about secondary burnout if we wanted to.
Oh, God, no. That's my day. That's what I have planned.
What, burning out?
Yeah, secondary burnout, man. That's it. That's all I have got.
I've already gone through primary. Now it's time for secondary.
Oh, man. All right, so... for once again, for the applications for T.A.C.O C.A.T, Workforce Center, where else? Counselor's
office. Yep. Or I don't think they have them at Coastal Connections, but you could ask them. But Workforce Center is nearby. Okay. So Workforce Center and Counselor's Office.
And we're still working out because we're also recruiting for this and for the other two. And I'm trying to get it all kind of honed in the same sort of thing for all three of the programs we'll be working on. So, I want to get
if you have
connections
interested in media.
In Castle Rock, Sunset.
Yeah. All of them.
All of that stuff. We want to get into all the schools and get in front. Yeah. And if you've got a band kid or a theater kid, a drama kid who's got a lot to say, or needs to say something, or needs a lot to say.
Can't stop making TikTok videos.
Right. There you are.
That's our demographic. Let's go.
Yeah.
You got a little local influencer in your house. Send them our way because we need them to influence some stuff.
Exactly. Wow. Yeah, this is going to be pretty cool. This is really sweet. So applications due by the 22nd of this month, and then the boot camp starts, the 17th, you said? The 19th, something like that? The
23rd.
23rd of June.
No, that's when they start here. The boot camp
the
starts
week
the
before.
16th.
The 16th, right?
Yes.
16th through the end of the 20th.
We'll just throw a million dates at you.
It's going to be a whole bunch. Just
really
get the application in by May 22nd.
Yeah.
Do that. Get the and then we'll sort out all the other details.
Yeah, then we'll tell you the rest. Step 1.
If you have questions, you can reach out to us as well. I'm Amanda Doctor. I am a station coordinator, and I will be assisting with supervising this program. And I'm happy to answer questions to the best of my ability if somebody wants to reach out.
Yeah, you can reach out to RX Safe Del Norte if you have questions about any of the stuff I talked about. I am happy to go deeper on any of these subjects, and I will go through the budget line by line with you if you want.
All right. Well, Jermaine, thank you very much. Look forward to working with you all summer long and doing some good in the community. It's going to be exciting.
Yeah.
All right.